With the new year upon us, many people are making resolutions or maybe looking for ways to improve their health. Well, a popular commitment we see this time of the year is called Dry January, or essentially abstaining from alcohol for the entire first month of the year.
So is it worth it? Let's get into it with Dr. Margaret Schwiso, who's a gastroenterologist with Kaiser Permanente. So doctor, thanks for joining us. Let's start with your particular area of expertise. So giving up on booze for the whole month is going to do what for our gut health?
Absolutely. Thank you for having me. You know, for years, we've been told that low to moderate alcohol consumption was actually perfectly fine, even safe or beneficial in terms of red wine, for example. Well, recent systematic review and a meta-analysis published in JAMA showed that we were pretty wrong about alcohol. It shows that moderate to high alcohol consumption actually significantly increased risk of all-cause mortality among people who drank more than 2 alcoholic beverages per day. We also know that moderate alcohol consumption can increase the risk for cancers, for example, head and neck cancer, esophageal cancer, breast cancer, and the cancers of digestive tract, liver, pancreas, colon cancer, and so forth. Alcohol consumption has also been linked to increased high blood pressure and serious heart arrhythmias called atrial fibrillation.
So if you can actually follow through with Dry January, no alcohol, what kind of benefits would you see essentially?
You will see a lot of benefits. One of the benefits as a gastroenterologist that I see in my clinic would be improvement in your digestive health. So improvement in bloating, nausea, change in bowel habits, but you will also feel maybe improvement in overall fatigue, brain fog, and just generalized improvement in exercise.
So doctor, based on that, I have to imagine this is something that you are suggesting to a lot of your patients. Along those lines, are we seeing any specific age groups, like Gen Z, millennials, doing Dry January maybe more than other groups?
You know, I think January is such a perfect time because people are coming up with new resolutions. They're thinking, okay, what can I do to improve my overall health? So I do see it across the spectrum of ages.
All right, quickly, DC data says over 25% of adults binge drink. So what if you only make it through damp January? Do you still get some of the benefits if you maybe halfway participate?
Absolutely. This is not all or nothing intervention. So even slightest reduction in alcohol consumption will have a positive impact on your overall health.
That is good to hear. I'm doing it. This will be the second year I'm doing it. You're going to go for it?
I'm going for damp January, but
we'll see what happens.
Yeah.
All right, listen, Dr. Schwiso with Kaiser Permanente, thanks so much for taking the time. Appreciate talking with us, and Happy New Year.
Happy New Year to you. Thank you.